Hi, Dr. Wallach. My name is Hassan, and I'm just calling about I have a son, 4 years old, and almost right now 4 months, the same diagnosis with a diabetic, and they give him the insulin for the night time, and one for the daytime, controlling for the sugar.
Okay, let's stop there for a minute. Now, did they diagnose him as type 1 diabetes or type 2 diabetes?
And type 1.
Okay, type 1. Okay, any other issues? Does he have any asthma, respiratory problems, any skin problems, any eczema, dermatitis, anything like that?
No, we don't have anything.
No skin problems, no respiratory problems?
Yep.
Okay, no. Does he have any belly problems, constipation, diarrhea, gas? Does he complain about his belly hurts?
No.
Okay, good. How much does he weigh, Hassan?
34.
34 pounds, okay. And,
yeah.
All right. What's his first name? What's your son's first name?
Yeah, Mubarak, M-U-B for book, A-R-A-K. Mubarak.
Okay, I didn't quite get the pronunciation, but I believe you. Okay. All right, Charmaine, you there?
I'm here, yes, I'm here.
Okay, here's a 34-pound, 4-year-old who has type 1 diabetes. What would you do for him? You know, we can't reverse type 1 diabetes. If it's truly, truly type 1 diabetes, this is a birth defect. Mama was missing something when the beta cells were being formed in the islets of Langerhans and the pancreas. Don't have enough of those, does not produce enough insulin, and so he has to have an outside source of insulin, usually by injection, and this is a lifetime deal. However, with one of our programs, he can actually do better than just with insulin. You have to change his diet a little bit. We have to give him a supplement program. He weighs 34 pounds. What would you give him as a supplement program to support the best that he can do? In other words, we might be able to reduce his insulin needs by injection. We can reduce that significantly, whether it's 30%, 50%, or 90%. We don't know yet, but certainly we can reduce it. Okay, again, his son is 4 years old, 34 pounds, has type 1 diabetes. What would you do for him?
Well, for his issues, I would get him a healthy blood sugar pack and split it in half and give him a quarter in the morning and a quarter in the afternoon, which it'll last 2 months.
Okay.
And then I would also get him some vitamin B3 too.
Okay, very good. And of course, let's get the whole household on a special diet. No gluten, no wheat, barley, rye, and oats. Let's maximize the absorption of the nutrients. No wheat, barley, rye, and oats. No gluten, no fried foods, no processed meats, no oils, no olive oil, coconut oil, margarines, mayonnaise, substitute cooking oils. Absolutely no sugar, naturally processed. It means no juices, no fruit. He can get everything he needs from vegetables, so he doesn't need to eat fruit and sugar. Okay, juices, all that's got to go since he's diabetic. And as Shar said, for a 2 month supply, get him one healthy blood sugar pack. Give him a half a dose every day. That'll last then 2 months. And divide that half a dose into half. So you're going to give him a quarter of a dose at breakfast, a quarter of a dose at dinner time. And, of course, measure his blood sugar as often as necessary according to the doctor's instructions. And the odds are if he's truly a type 1, you will not be able to totally wean him off of outside insulin. You're going to have to give him injections. But we can help him reduce the amount of insulin he requires every day. And also we can reduce the number of times you need to stick him every day to check his blood sugar. Give us a call every couple of weeks, Hassan. Let us know how your son is doing. You can start the diet as soon as you hang up. It'll take about 2 to 5 working days to get the product to you in Arizona.